vlog. Today I'm taking you behind the scenes at the Dr. Asaadi medical office, where I'm going to be undergoing an under eye filler procedure. That's the procedure Dr. Asaadi recommended to me a few weeks ago when we met at his office for some other treatment, and I thought we should collaborate because I really want to show you guys what it entails to get this procedure. Dr. Asaadi is a board certified plastic surgeon. He practices in New York and also in New Jersey, so we are heading to his New Jersey office today. He has an amazing amount of experience. He has been in practice for over, I believe, 30 years. He is a very renowned plastic surgeon. And what really attracted me to him in the first place, and what really spoke to me the most, was the fact that he really takes his approach very personally. We all have different structures, different facial structures, so it's very important to get that personalized treatment. So yeah, under eye filler. So basically he's gonna inject some filler right underneath, like here, like upper part of the cheeks, right underneath the eyes, to help boost that area and give it a little bit of volume. And obviously as we age, we tend to lose volume and we tend to get like flat and hollow, and why shouldn't we help ourselves? Right? So this is what I will be doing right now. Let me put my glasses on because it's sunny today. So we'll get into those details once we get there, so Dr. Asaadi will be able to explain the treatment a little bit more. And yeah, it's just so funny. I'm talking about it as if we were going for a lunch date. It used to be such a taboo topic back in the day, and now you mention Botox and no one raises their eyebrows anymore. Just literally. So yes, facial procedures, facial rejuvenation procedures are a big thing now. Obviously everything in moderation, so I'm excited to try it, and I hope you continue watching. All right, great. So now I'm in Dr. Asaadi's office. Hello, how are you today?
How are you doing?
Thank you for having me. I'm very excited to learn more about the treatment. So Dr. Asaadi will walk us through the entire procedure, but first, if you could explain what it means and what are we going to do here.
So tell me what you don't like.
So I have a little concern over here. Obviously, as we age, we tend to see as if we were not rested, a little bit of hollowness, so I kind of want to really target that treatment.
So what you have, you look in the mirror, and I'm going to explain to you. You have a small amount of the hollowness here that comes from the corner of your eyes to the mid part of your lower eyelid pupil area. Is called nasojugal groove or tear trough. Very small amount, not too much. So in order to correct the nasojugal groove, we can use a filler for you.
And what's the name of the filler?
We are going to use the Juvederm for you. I use the Juvederm Ultra Plus XC, which means that it's an extra comfort, has an anesthesia in it.
Great. Let's show to the camera. So that's the product we're going to be using. And it's a hyaluronic based product, correct?
So hyaluronic acid, this is hydrophilic, absorbs water. I like them for the lower eyelid and the lips. So we have to use a under correction for you because it's going to absorb water.
Less is more.
Less is more. And we are going to use a cannula for you. So what we do, we clean your face, we mark this area, we pick up a 1 point here on the mid part of your face, we give you a local anesthesia to numb it, and then we use a cannula very deep to fill those nasojugal groove.
Great.
You will see the result right away. But I'm going to under correct it because tomorrow you are going to get better, next week you are going to get better. This product is supposed to last 1 year. I have a patient I have done 5.5 years ago, still they look good.
Hopefully that's me, right?
Yes.
Great.
So that's what you need.
Awesome. All right.
You have to be very clean when you do this procedure. Anything else?
It wasn't a good idea to come with makeup.
That's all right. Take them out.
This is why Dr. Asaadi went to medical school, to remove your makeup.
Well, it's a good skill to have too, right?
Look up for me. So the product is going to go right here and right here. And I'm going to go from here and from here.
Interesting.
And you're not allergic to anything?
No.
So we'll clean this one again. And I'm going to give you local anesthesia to numb you for 2 reasons. Number 1, not to feel anything. Number 2, not to get bruised and black and blue. So when I inject you, little pinprick, you're going to put the pressure here so you don't get bruised. We're gonna do the same thing here. Small amount of pinch here. Good. And we are gonna put the pressure here. That's it.
I'm giving you a close-up, guys, here.
So this product has a small labels with expiration on it, with a lot number, so we always keep it in your chart, and your chart is recorded and marked to tell you exactly where this is done, how much is done, everything else.
Great.
So I waited few minutes for this thing to cause vasoconstriction, so you don't get bruised. So you can see again where I'm gonna go this direction. You see this here?
Great. So it basically will also help volumize this area, correct?
Yes. But again, small amount, minimum.
Yes, minimal. I'm also all about very, very natural looking results. You don't want to look as if you had procedures done. You just want to look like the best version of yourself.
So we clean you many, many times because you have to be super sterile with this. The first thing we do, we make a small opening with a sharp needle. I go 35-degree angle toward that nasojugal groove, and since you are numb, you are not going to feel anything.
And now we're going with the cannula, correct?
Yeah. We always bring the material to the tip of cannula, and this is, as you can see, is blunt. It's about 2 inches. Yeah. So I go here.
Ooh, that's
This has anesthesia in it. Then you are going to look upward. I just bring the cannula right into your nasojugal groove. I can see the cannula there. And then I inject when I'm withdrawing the cannula, so I don't inject any blood vessels. Minimum amount.
perfect. All right, that was easy.
Did it hurt?
No, very easy.
Okay, good.
Just strange sensation at first. But
Okay, we're going to break it back down. We're going to turn it slightly this way. The people who have a deep line, you have to do more, but you are small amount of the filler you need.
yeah, it's all about also prevention, correct?
So I'm going to turn this way. We're going to look up. So I just move the cannula till I find the least amount of resistance. You don't want to push this thing too hard. It just goes by itself. There are ligaments here that it released by this. So I can feel the tip of the cannula here, right in your nasojugal groove.
Wow.
I do deep and I just come back and I inject you while I'm withdrawing. That's it.
All right. Easy.
Okay, come up, let me see you.
All right. Easy. What's like the post-treatment procedure?
Nothing.
Nothing.
Nothing. You don't have to do anything. The only thing you don't do is that you don't put the makeup on for 2-3 hours.
Okay.
Put your head back.
I
I'm going to
can
take
do
the marking off.
So that's it.
And we are going to check you usually about a week or so to be sure everything's fine.
Oh, okay. So I need to come back for consultation.
Yes. Yeah. Just to be sure everything's fine.
Right.
Any question?
No, I think that was super easy. Thank you so much. I was.
Did it hurt?
No, not at all. I was ready for it, but it was
No, it
actually
doesn't hurt
very.
at all. There's no pain.
Yeah, no pain. Very quick, as you can tell. And that's pretty much it.
He sees the result right away, which is very less than 5 minutes and painless.
It's rewarding already.
And then after a few days, this absorbs water, becomes even better.
So it's a great treatment for someone who struggles with hollowness of the under eye area,
Exactly,
correct?
yeah.
And also it's a good preventative treatment as well.
Yeah. And this one, as I told you, is supposed to last 1 year. I have the people who have a good result after 5.5 years produce probably collagen there that cause that correction of that area.
That's amazing. Yeah. All right. Thank you so much for
My pleasure.
for the treatment. I truly enjoyed it. Thank you.